these excellent concepts. And I'm going to share you a little bit about César. César, like many of you know, is a pediatrician, a full-time pediatrics and global health professor at Tech of Monterrey. César also is a former fellow, as well as associate fellow for the Association of Medical Education in Europe, the AMI. And he has completed postgraduate training in health professions education by Keele University in the UK. His expertise revolves around learning communities, clinical skills assessment, online education, competence-based education, faculty development, and curriculum design. In 2019, he received the Teaching Excellence Award by the U21, so he's one of our distinguished faculty, not only for the Tech of Monterrey, also for the whole university's health sciences group. He also formed part of the IFON committee of the National Board of Medical Examiners. And more of that, César is a great professional, is a great professor, and a very dear friend of us. So César, welcome to this morning to this conference, and I know that it will be very helpful for everyone to listen to you and to share with you all this interesting conference that you will teach us.
Thank you, Dr. Pérez. Good morning, everybody here in Monterrey. Good afternoon, good night, wherever you are. My name is César. And today we're gonna have a conversation about what are the secrets for a highly efficient interdisciplinary healthcare team. Okay, this is a topic that has a lot of situations where we could discuss. The plan is to keep it dynamic, so you guys are going to participate, hopefully. And to start with, I would like to say that the field of healthcare, there is a growing dependence on interdisciplinary teams. The more complex our healthcare becomes, the more need there is for different disciplines to work together in patient care and in community care. And even though interdisciplinary teams have the potential to improve healthcare, they are facing, or we are facing, different challenges that we need to know how to sort out, and we're going to talk a little bit more about that later. And there is a growing need to implement strategies to improve the approach and to provide quality healthcare from all these different disciplines working together. Medical error is one of the leading causes of death in developed countries, and great part of these medical errors are consequence of lack of teamwork failures, like lack of communication, people not getting along or working together, people don't having clear what roles or responsibilities they have. So it's very important for professionals to know how to work together since early stages in their training. Interprofessional learning or interdisciplinary care, it's something that it's very well known of. There's lots of publications, articles, papers, research about it. We are talking about it in conferences like this one. There's actually a whole interdisciplinary, interprofessional group that met today. So it's something that we know about, that we talk about, but how can we actually get everybody to work together in the benefit of the patient? There's a lot of terms tossed around, like interprofessional, multidisciplinary, transprofessional, multiprofessional, multidisciplinary, interdisciplinary, interprofessional, and among others. So how can we make sense of all of these terms and all this terminology? Well, we're going to try to make sense out of it right now, but not even in the medical education or health professions education world can we really reach a consensus. Like, there's articles in which different parts of the world use different terms, different academic sites use different words. There's even systematic reviews where interdisciplinary, interprofessional, what are the differences, what are different terms. So even though we're going to try to define the terms today, Probably there's still a lot of research to be done to come up with the best terms and for all of us to speak the same language. When we talk about discipline, we talk about the body of knowledge. We talk about the body of scientific knowledge, the theories, the frames of reference, and it's normally focused on academics. Okay, so we're talking about what is the body of knowledge that specific to that discipline. When we talk about profession, we talk about an organizational body of people. So we stop talking about the knowledge and we're starting to talk about people now, focused on regulating, defining, monitoring the standards of knowledge and service. So this is a group of people that focus on providing care, in this case, which we're talking about healthcare, and they are also in charge of defining the ways that this knowledge is going to be organized, that this discipline is going to provide their service. When we talk about multidisciplinary, we talk about skills and experiences of individuals from different disciplines. I wanna stand out the word individuals, which are from different disciplines and they are used each from their own perspective. Interactions are very formal, work is very independent, one discipline from another, everybody does their thing, and we all agree that we all do our little part, and it's sometimes also hierarchical. So even though multidisciplinary is something we want and we like, it might not be the best way of interacting. When we talk about interdisciplinary, we talk about different perspectives that are integrated within a common vision, and different clinical or research avenues and are discussed, proposed, analyzed. There's a common goal, which normally is the well-being of the patient or the community. There's greater communication and collaboration. So when we talk about interdisciplinary, people are working more closely together, responsibilities are being shared, there's a common goal, a common vision, and this is something that we try to aspire to. When we talk about transdisciplinary, we talk about interactions where the lines are blurred. Like you cannot really tell where the group of nutritionists and the group of dentists and the group of physicians, and they're all working together. There's hardly any lines. There's mutual trust. There's teaching and learning, and this is important across all disciplines. And we have shared responsibilities. When we talk about interprofessional, we talk about the group of people that are focusing on the community, on the care of the patient, and they're using their disciplinary knowledge to work and learn together. So as we can see, there's a lot of terms. It's sometimes confusing using one term or another, but we're slowly reaching a global consensus as the years pass by. So I want to ask you guys, and if you could help me out on the chat, I want to ask you guys if you could help me out naming what do you think is the best team of all times. You can just write it on the chat. I would like to hear some or listen to hear or read some options. It could be sports, it could be music, it could be in politics. What do you think is which one is the best team of all times? I wanna read to you in the chat. I'm gonna give you a minute to think about it. Maybe it could be a team that you guys saw in the sports world. The Rolling Stones. Okay, so that's in music. It was a good team. I would like to learn a little bit about how they communicate between each other, because sometimes there was discussion amongst them. Any other teams that you guys know of, or you think they're the best teams ever? The Real Madrid, of course, is one of the best soccer teams in the world, or football teams in the world. The Dream Team in the 92 Olympics, that's another good example of a team. Anybody else? The Chicago Bulls. Okay, that's a great example also. And actually, the healthcare teams in the COVID-19 pandemic, that's right. Hats off to all the healthcare teams in the COVID-19 pandemic. We all have lots of good examples of that working. And I just want to use the following example, which somebody already mentioned, which are the Chicago Bulls back in the 90s. So the Chicago Bulls are this emblematic, iconic basketball team from around 92 to 97. They won the NBA championship 6 times in a span of like 8 years. We all remember Michael Jordan, Scottie Pippen, Dennis Rodman, Phil Jackson as a coach. And we remember that team as a team that was working very well, giving great results, performing in an excellent fashion. And I would like you guys to think, which are the characteristics of a highly efficient team. Okay, we're gonna go in pairs. So I'm gonna ask for the coordinating team to help me out to make breakout rooms of 2 people. Okay, we're gonna go out in pairs, and I want you guys to take a minute first individually before we go into the breakout rooms to think, what are the characteristics of a highly efficient team? What are the characteristics that you might define that make the Chicago Bulls who they were, or any other teams that you can think of? What are the characteristics of a highly efficient team? I'm going to give you a minute on your own so you can make some notes and write down those characteristics. After that minute, we're going to go into breakout rooms of 2 people. Actually, you know what? Let's make them 3 people, because sometimes people might be paired up with somebody who's not there, or somebody who went to the bathroom or something. So that happened to me last time. So let's do it in groups of 3 people, please. So we're gonna go around in around maybe 7 groups. Okay. So now that you thought about the characteristics of a highly efficient team, we're gonna go in groups of 3. And I want you guys to discuss your choices, your reasons why you listed them, and then that's gonna last 4 minutes, and then we're gonna come back. Okay, excellent.
Alguien que nos ayude a enviar algún participante al grupo 2 para complementar ahí a Sandra, que entré a ese grupo, pero no está, no contesta, no parece no estar conectado.
Ok, envío a alguien del grupo de la sala 4 o 5 que tiene más participantes.
Ok. Al grupo 2.
Listo.
I'm gonna send a message that there's 1 minute left.
Ok. Ready.
Okay, we're back. We are back, and I would like you guys to hear me out and just write in the chat, whoever was in the breakout rooms, like, what were the characteristics that you guys named as a highly efficient team? So you could just write them down. It doesn't have to be in any order, specific order. But I would like to hear your choices, so we can maybe have a little bit of a discussion right now. I mean, just write on the chat, what were the characteristics that your team or your group discussed as a highly efficient team? Goal-directed design, okay. So they're designed specifically to fulfill a goal. Anybody else? Any other characteristics? Communication, multidisciplinary, respect, responsibility, well-defined roles, which is one of my favorites because it's very common that you go into a team and you don't know what your job or your role is. Supportive, okay. Good work environment, which is also something we're going to talk about, which is very important. Active listening, constant communication, empathy, roles, and feedback. Wow, that was a very complete list. Thank you, Ana Karen. So as you can see, there's nothing new under the sun, as we could say. Like, the characteristics you mentioned are the ones that are mentioned in literature. Confidence, clear communication, define roles and responsibilities, a leader who's involved, shared goals, drive, which is an element that I love, which is how can we move towards what moves us, what makes us choose this path. Conflict management, diversity, and accountability. These are some of the characteristics of highly efficient teams, and we're gonna talk a little bit about them. What are the functions of a healthcare team or a health team? Decision making. We make decisions every day in healthcare, especially when we are amongst interdisciplinary teams. We make a diagnosis, we provide follow-up, we develop a therapeutic plan, and we solve problems. These are the basic functions of a healthcare team. And we take into consideration that we want to improve communication, we want to optimize resources, and we want to reduce the risk of health or medical errors. Those are the basic functions of a healthcare team, and those are the ones that we have to take into consideration when we're talking about highly efficient teams. First, I want to talk to you about a concept that's called collective intelligence. So when we build a team, we wanted to have a high level of collective intelligence, and we talk about that when we say that it's group intelligence that is obtained through collaboration, joint efforts, and consensus in decision making. So we want each member of the team to use their different type of intelligence, their different backgrounds, their different perspectives to make decisions and to solve problems in a different way. Normally, we think about collective intelligence, or we think that get the smartest people in one team, or build a team with the smartest people you can find, with the most intelligent people you can find, and this is going to be a great team. And that's not necessarily true, because I could have in the same group or team highly intelligent people, very smart, very capable, but if they don't bring anything different to the table, if they all think the same, or if they don't know how to get along, then that team is probably not going to deliver and it's not going to perform as we would like to. So when we talk about collective intelligence, we talk about the ability to solve problems, summing up all the abilities of the different members of the team. There's two types of processes. First, we call it top to bottom. So it's very simple. How can we add the skills and the intelligence and the abilities and the competencies of each of the team members, and they could build upon each other? It could be, we could use a team that's very diverse cognitively, that they could have very different ways of thinking, very different ways of looking at things, and that's going to enrich the team way further than if it's just people who think and believe the same things. When we talk about the process from the bottom to the top, we talk about how can the teams generate norms to interact among themselves. How do they take turns? How do they regulate their own collaboration? How can they encourage communication within the team? How can they always think about the team as being as equals? So these processes from bottom to top also need a type of collaborative intelligence so the team can function. Because yes, we have a lot of different thinking styles, we have a lot of different intelligence, but if we don't generate the adequate norms to interact and to relate, the team may not perform adequately. And what are the success factors for using collaborative or collective intelligence in a team? First, we would like the team to be interdisciplinary. Anytime we can, in every single decision we can make, if we can make the team interdisciplinary, we can have different perspectives from different people, that decision might be a best taken decision. We want members of the team who have different ideologies, different abilities, where a good discussion can arise and we could reach conclusions that we might have not reached if we were only by ourselves or with people that think exactly like we do. We want good communication among the team members, different interpersonal skills so people can get along and can reach consensus and make decisions and walk or advance towards a goal. And we also want people to acknowledge their mistakes and how can we learn from them. So we can reach all these success factors if we can build a very well-designed team and with different elements in their collective intelligence. Now, this doesn't mean that we cannot perform with teams that are not specifically designed for this. Sometimes we can get thrown or we can get added into a team that might not be, designed specifically to be a high performing team, but we can all sum our capabilities to communicate and to relate and to bring our own opinions towards the goal. It's very important for most of the team members or all of the team members to be able to speak up. Okay, this is a very important concept. We will not be able to influence other people or other persons within the team if we don't speak up and we don't express our opinion. Sometimes we can have very capable people within the team. We can have persons who have a lot to say, who have very interesting ideas. But if we don't hear them, if they stay static or stagnant, and they don't really have a forum for them to express themselves, it's going to be very hard for other people to be influenced. So we need to always make a space for people to express themselves and to speak up when we're working in a team, so other people can get to know what they're thinking. What are some challenges when we want to participate or to share information within the team? First, members may not be aware that they have relevant information that is worth sharing. So this is very common. Sometimes I might have a good idea or I might have something to say, but my own, you can call it, security, self-esteem, or my own sense of what I have to say, if it's right or not, it stops me or it stops people from sharing what they have. So always, even though it might not be the best idea, even though it might not be what I consider be groundbreaking, it might be worth sharing. So if you have something to say in a team, speak up, speak your mind, and also look for teams who give you the platform to do it. Another challenge is the common knowledge effect. It's very common for team members to think that, we're in this group, we're planning this conference, for example, and we all think that everybody knows a concept. But no, maybe not all people know it. Maybe this is something worth taking 5 minutes to discuss it, and something that we think that everybody else knows, and that it's not worth it to set some time aside to discuss whatever concept or idea. It might be a good idea to reevaluate that and to maybe not assume that everybody knows it. Social stereotypes is a very big one in healthcare teams, for example. When we talk about different disciplines, maybe the physician or the doctor is in some societies or some cultures has to be the leader of the team, because it cannot be the leader, cannot be a nurse, cannot be a dentist, cannot be a nutritionist, has to be the doctor. So those are stereotypes that normally don't help us achieve better results. So we need to get rid of social stereotypes and try to think a little bit more in regards of how can the team make better decisions. In psychological safety, this is a very important concept. People who don't feel safe within a team, who think that they might get punished, or they might get pointed out, or they might get singled out, or they might lose their job, they will try not to share information. They will try not to speak their mind because they don't want to get into trouble, or they don't want to get singled out. So we'll talk a little bit more about psychological safety later. What are some strategies for inclusion within teams? First, we would like to get as much information as we can from other members. Okay, we can ask explicit questions about information that is inconsistent or has not been discussed. We want people that haven't spoken their mind to do it. We want to show appreciation for contributions, okay, of other team members. We can improve teamwork if we react to contributions of others in a constructive way. We want people to have diversity of opinion. So we want to value different opinions as useful, even if they're, quotations, the wrong idea, because this can foster creativity, it can improve decision making, and it can help us have better problem solving skills. So we always want to look for as much information from other team members as possible. We want to show appreciation for contributions of other team members, and we want our teams to have diversity of opinion. I want to recommend you a book. This book is called Collaborative Intelligence, Using Teams to Solve Hard Problems by Richard Hackman. I like this book because it talks about the intelligence community, for example, the CIA or other intelligence communities in the UK, for example, these very difficult tasks, very difficult counterterrorism objectives and missions, and how did these teams who were in very adverse conditions, who had very difficult tasks, who were under a lot of pressure, how could they perform in such an excellent manner? So I really recommend you this book. And from this book, I wanna draw this concept, the 60-30-10 rule. So when we talked about teams and how successful they are, normally we have certain ideas that might not be the right ones. So first, when we talk about how the team is structured, 60% of the success of that team is going to rely on the structure of the team. Is this a team that has a diverse catalog of members? Like, are these people with different capabilities, different skills, different ways of thinking? Are these people who know how to work in a team? Are these people who have good interpersonal skills? Are they there for the right reasons? 60% of the success of that team is going to rely on how the team is structured. 30% of the success is going to rely on the way we launch that team. Do they have all the resources they needed? Do they have the guidance, the support system that they need? Do they have time to do what they need to do? So if we launch that team in a proper way, with resources, time, support, 30% of that is going to be the success of that team. In contrary or opposite to what we think, normally we think of a team that has to have a great leader, an inspirational leader, somebody who tells people what to do and how to do it, or a coach. But only 10% of the success of this team is going to rely on the level of coaching or of leadership. The other 90% is going to rely on the team members and how we launch them. So this is something to think about and to try to bring down the idea that a team is all about the leader, and not necessarily. Okay, normally we face different challenges when we talk about teamwork. Okay, so I want to take a minute to discuss and to talk about these challenges. And I want you guys to tell me if any of you have worked with a team like the one you're seeing on your screen. Has anybody ever had this team of maybe, people with, very capable and almost, sometimes irreal capabilities, and well, maybe some of us. What about this team? People who don't seem to have an idea of what they're doing, and the leader might be, a little bit confused, and people might not be there for the right reasons. Or a team like this one, who are very intelligent people, very capable, but they don't have the least interpersonal skills to develop a high-performing team. Or a team like this one, where, well, luck is a big part, a big chunk of the results, and we're constantly confused, but at the end we deliver the results accordingly. So there's a lot of challenges teams can face. So I want you guys to remember, we're gonna go back in groups again, I want you guys to remember a team in which you have participated. So I'm gonna give you a minute to think about, it could be a team that you participated back in university, or right now that you're at the hospital, or in a project. What are the main challenges that team performed or had in order to perform well or excellent? Okay, so I'm gonna give you 1 minute to write down some notes and try to think about what were the main challenges that you faced when you were in that team. 1 minute, and then we're gonna come back. And then when you're ready, when you have written down those characteristics or challenges of the team that you belong to in order to perform well, I want you to join the breakout room, and we're going to have a brief discussion, maybe a 10-minute discussion about what you're seeing on your screen. Share details about that team. What was the task or the project that you were thinking about? What were the main challenges that your team faced, and how do you overcome them? And we'll come back. For whoever's coordinating, if you see that there's some rooms that are with very few people, you can just join them in one big group. Daniel, ¿sí me escuchas?
¿Perdón?
Los del grupo 1, ¿por qué no? Ah, no, ya se están juntando. Si ves que está alguien solo, mételo a otro grupo, no, por favor.
Ok.
Susan, hello. We're right now having this discussion in breakout rooms. So is it okay we send you to a group? You can just listen if you want.
Yeah, no, sorry. I think I logged on too early. I was logging into the social event thing.
Oh,
Yeah.
okay. We're in the medicine group right now.
Yeah, and I'm in the physio group, and we have a discipline meeting later
Okay.
on. So I think I just got the different links
Okay,
wrong. Yeah.
no problem.
So
Okay.
thank you. Keep up the good work.
Thank you.
Bye-bye.
Perdóname. Okay. Thank you, guys. Thank you, everybody. Thank you for your discussion. So I would like to hear from you. If you could just write on the chat, what are the challenges that you faced for regarding the teams that you participated in the past? Could anybody name a couple of challenges that you guys faced on the chat? That would be great. What challenges did your teams discuss regarding efficient teamwork? Overriding other members, okay, that's a good one. Overriding other members' expertise. So some expert members might expect their opinion to be taken as final maybe, or as the best opinion out there. So it's hard to override it. That's a good example. Anybody else? Any other challenges that you guys faced in your different teams? Lack of communication and feedback, that's a big one, yes. Interprofessional communication, okay, so the lack of, okay. Fear of giving your opinion, okay, how to integrate a new surgical team during residency, okay. Okay, so as you might see, most of the challenges that you guys discussed are amongst these ones. Communication, like you guys said in the chat, accountability, who's going to be responsible for the actions or decisions that didn't come out right? Who's going to make the decisions, or how are we going to do the decision making? Who's going to train the team? How are they going to develop themselves? Is the team going to have time to reflect about the progress? And how are they going to manage the different conflicts that might arise? First, let's talk about accountability. Okay, I like this model that I want you guys to take a look at when we balance accountability and psychological safety. Psychological safety we refer to when somebody in a team they have the confidence that in their team they're safe, that they can express themselves, that they can express their opinions, that they could maybe make mistakes and nothing is going to happen. If nothing is going to happen, then they have high psychological safety. If in a team you make a mistake, or you speak your mind, or you maybe want to make a proposal and you don't feel safe, you feel like you might get fired, or you might get punished, or you might get laughed at, well, then your psychological safety in that team is very low. And when we talk about high accountability, we talk about team members that feel responsible for their actions and that they know that there might be an impact about what they do. So when we're in a team that has low psychological safety with low accountability, then we're in the apathy zone. Yeah, what's the point to work? It basically makes no difference and nothing's going to happen. So then I'm just going to be apathetic. If the psychological safety is high, but the accountability is low, then we are in the abatement zone. I mean, if I'm going to have a lot of consequences in my work, but I'm not really accountable for it, then why do something about it? I mean, I'm just going to lay low. If the accountability is very high, but the psychological safety is very low, then we are in the anxiety zone. I'm going to be very nervous, very anxious. I might lose my job. I might get laughed at. I might get punished. So I'm very stressed out. And also I'm very accountable for my actions. I might be asked for results. So then that's not a good zone where I want to be in. That's not going to make the team perform. But if the accountability is high and the psychological safety is high, then this is the achievement zone. This is where people do their best. This is where teams perform at their best. So we want them to be accountable, but also to be in an environment where they can be safe. What are some recommendations for accountability? First, we know to create a safe environment, have regular meetings or check-ins with the group. We need to have regular meetings where how are we doing? How is everybody going? Do we need anything? So have these meetings or check-ins, and to point out mistakes privately, to have a high psychological safety. Like if somebody made a mistake or needs to be corrected, it could be done in private. But if somebody needs to be praised or needs to be congratulated, it needs to be in public, so that team psychological safety can grow. Conflict is one of the things that as teams we want to avoid most of the time. We don't want interpersonal conflicts. We want people to get along. Sometimes there's differences between values, opinions, personalities might make conflicts arise. So if we want to maintain psychological safety, we want other team members to openly differ, to listen to each other, to respect their contributions, and also to avoid taking comments personally and to try to stay focused on the task or the goal of the team, not in the individuals or the members. So we can have a efficient conflict resolution. The most important tool is negotiation. Find middle ground. No one can win it all. No one can lose it all. Be ready to give in some parts and not to give in others. Create solutions that most parties agree with. Try to actively listen to the other person's perspective. Sometimes we don't want to listen and we don't let other people, express their opinion. So be an active listener and give other persons a chance to express their opinion. And ask questions about positions that are not yours. Like if you ask somebody, if you don't understand somebody's position or perspective or opinion, ask them questions about it. Like I want to understand your position, so please give me information so I can understand. Decision making. This is a very important part of team dynamics. When we need to face a decision, first we need to define the problem. Not because sometimes we want to jump up real quick to the solutions, but we have not defined the problem first. So we need to define the problem, not the solution. We need to promote critical thinking. We need to expect and handle disagreements. There will be disagreements. There will be conflicts and problems, and we need to expect they're going to happen and handle them well. We also need to have realistic expectations about the decision we're going to make. Like we cannot think that this decision is going to change the course of history and we're going to be the best institution, university, or group ever because of this team. No, but we can have realistic expectations and we're gonna have realistic goals. And one of the most important advice is to don't waste time on small decisions. It's very common for our teams to be wasting tremendous amount of time on small decisions. Emails go back and forth. People need to okay everything, meetings on a tiny decision. So we need to be intelligent and smart about how to make these small decisions and don't lose time. I know Jeff Bezos is not maybe the best, personal example of a lot of things, but regarding managing teams and making decisions, he has a good model that I want to share with you. So when managing teams, we can divide decisions in two categories. Do they have consequences? And are they reversible? So we're going to try to make decisions regarding these two variables. For example, if we want to make a decision that doesn't have any consequences and that is reversible, we can decide right there on the spot. Based on an experience, we can just, okay, this is what we're going to do. We're not going to waste time in this. It has no consequences. It's irreversible. We can set a reminder later to come back and check of the outcome, but let's decide right now. If the decision doesn't have any consequences, but it's not reversible, then we can still decide on the spot. We can take a minute to review the available data. We can base it on experience. We can set a reminder to come back and check, but we can decide right now. Okay. If the decision has consequences, but these consequences can be reversible, then we can take a step back, review the data, understand the impact of the decision. We can decide rationally based on data. We can set a schedule to review different milestones regarding that decision and make it. If the decision has consequences, but it's not reversible, then this is the biggest decisions we can make. So we need to do lots of research, explore all the different scenarios, evaluate risks, and decide very carefully in order to not make a mistake that's going to cost a lot of impact in whichever our target is. So this is a good model that works for a lot of people. So I would invite you to use it in your teams to try to make the decision making more efficient, and this can bring better results for your team. Another model, which is regards who makes the decision, not more when to make it. It's called the RAPID model from Bain and Company. So this model has 5 elements. First, the R in RAPID, recommend. Okay, somebody in the team recommends a decision or an action. Okay, what are we going to do about it? First, we need to agree, and that's the A in RAPID. Formally agree to a decision. Okay, we're going to agree that this is what we're going to do, and all the proposals and the views are taken into consideration. The P is to perform. Who's going to be accountable for the performing of a decision once it is made? Who's going to be the person in charge of responding for those decisions? Somebody needs to be named as a responsible for performing, and who's going to be accountable. And then the I for input. Anybody has any other input before we decide? We have the recommendation. We agree that this is the way we're going to take. We know who's going to be accountable. Any other views that we need to take into consideration? That's the I for input. And the D is for decide. Actually make the decision and commit the organization to act. Okay, so R, recommend, A, agree, P, perform, E for any additional I for any additional input, and D in order to decide. So this could be also another quick model that you can research and look up, and this might help you make decisions as a group. And very important, and I'm about to end my presentation soon, is to reflect on progress. Okay, it's very important for the team to allocate time to reflect on its objectives, strategies, or different processes for present or future situations. This is where creativity, innovation, reflection come together. Teams experience a high work. Some teams might experience a lot of workload, and normally they might not have the time to appreciate their achievements. So it's very important for teams to set a time aside, even though they're very busy, have frequent times for reflection on how teams are going and what changes need to be made. So we need to encourage our teams to spend time recognizing team achievements. We can constantly ask people about the kinds of problems they're facing, how can they solve them, and also use previous experiences to ask team members how to solve a problem in order to reflect about the progress and where the teams are going. So thank you very much. I hope these strategies and concepts can help you design and manage and implement and participate in highly efficient interdisciplinary teams. And back over to Dr. Pérez. Thank you very much.
Oh, thank you, César. A wonderful conference, wonderful concept that you share with us, and I think very useful for everyone in the different areas and scenarios that everyone has. And I opened the forum for comments or questions. If you want to make open your microphones and leave questions, or if you want to write it here in the chat, it could be any other options. Any questions or comments? Hi, any questions or comments? I think no more questions. You already give a lot of feedback during the presentation, and this was very important for us, particularly in the medicine group, because I think, personally, I think that doctors are the toughest people to create efficiency in the group and the group practices in the transdisciplinary or multidisciplinary teams. Sometimes doctors or physicians think that we have to leadership the groups and not to focus in the patient, not to focus in the main problem. And I think it would be very useful for physicians more than other professions. And if we don't have any comments or questions, I just thank again Dr. César Lucio for this great talk, and also thank to the team that support the presentation and the lip connection. And we'll see you in the next moments here in the U21 program here at the Tech of Monterrey. So thank you everyone for being here, and we'll see you later.
Thank you.
Bye-bye.
Bye.
Thank you, César.
Thank you. Bye-bye.
Listo. Gracias a todos. Thank you, everyone. Bye-bye.
It's been